Okay, welcome everyone. Now, this patient, he just had an upper respiratory tract infection. Now he's having bilateral wheezing. So this is acute bronchitis typical. How do you manage that? You manage that with symptomatic treatment only. Okay, so this is symptomatic treatment for acute bronchitis, which is cough more than 3 days and less than more than 5 days and less than 3 weeks. That's the thing. So here, pulmonary function test, we do it for chronic bronchitis, which is more than cough more than 3 months for 2 consecutive years. Azithromycin, amoxicillin, it's do it for community-acquired pneumonia when you have focal increased breath sounds, when you have crackles, when you have consolidation or chest X-ray, then we give that. Discontinuation of lisinopril if patient taking AC inhibitor, then we can suspect that due to bradykinin system. Okay, but it's unlikely to be the cause if the patient has already upper respiratory tract infection. Okay, period. So that's about this question. Go to the next. Okay, so this patient, this is a 7-year-old boy who present with nausea, vomiting, abdominal pain, and potassium is 5.8. So on ketonuria, glucoseuria, so started normal intravenous fluid. So what do you do right now? You admit him to the intensive care unit. So that's how you manage DKA for children. You give him IV fluid, isotonic fluid, and then insulin infusion plus isotonic fluid with potassium if he's potassium depleted. And you gotta monitor complication for cerebral edema, the present altered mental status. You gotta order CT just to rule out cerebral edema. So adding bicarbonate to intravenous fluid, actually we don't add bicarbonate and it's not shown to be beneficial. Plus, bicarbonate increases risk for cerebral edema, metabolic alkalosis, and hypokalemia. So that's why we don't do it. Antibiotic therapy. We give antibiotic if there is a sign of infection like bacteriuria, urinalysis, temperature is high. So that's why antibiotic, blood culture, urine culture is not necessary if there is no sign of infection, like in this patient. That's why we don't do antibiotic, blood and urine culture because there is no signs of infection. Serum lipase and acute and abdominal CT scan. So lipase we do it for acute pancreatitis, abdominal CT for acute appendicitis. So this condition doesn't cause hyperglycemia and metabolic acidosis that we see in this patient. This patient have hyperglycemia, the glucose is high, 500, okay? And metabolic acidosis, the ABG is 7. So this we don't see that in patients who have appendicitis or pancreatitis. So this is most likely is DKA, so just admit him to the intensive care unit. That's the most important thing. Period. So this is very important test for a 22-year-old guy who's just having wheezing and shortness of breath with exercise, most likely asthma. So what do you expect the pulmonary function test? So the pulmonary function test will be normal testing but an obstructive pattern following methacholine challenge. So that's the thing. So this, when you look at the increased FEV1 FVC and reduced total lung capacity with normal FVC FVC, those for restrictive lung disease. So that's the difference. Reduced because the FEV1 FVC both will decrease, so that's why FEV1 FVC will be either normal or increased. That's the difference. So normal testing but decreased diffusion capacity of the lung with carbon dioxide, Dlco. This one you find it in pulmonary arterial hypertension. This is an important one because I'll tell you because in pulmonary hypertension there's intimal hyperplasia, so there will be decreased capillary perfusion to the alveoli, so the diffusion capacity will decrease, so that's why the Dlco will decrease. But normal testing on pulmonary function test, which is very interesting. This one reduced FEV1 and reduced Dlco, that's a COPD. So reduced FEV1 and FVC both can happen in asthma and COPD. The only difference is the Dlco will decrease in COPD but not in asthma because in emphysema they will have destruction of the alveoli, so there will be decreased Dlco. That's why. But in asthma you don't have that, okay? Period.